Good morning, everybody. My name is Megan Flaherty. I am a social worker with the Hampton VA with the suicide prevention team. I'm very excited to be here today to talk a little bit about lethal means safety and what that means in regards to the veteran population and the population as a whole. But we talk a lot about lethal means safety when we're talking about suicide prevention. And it's an important topic to have knowledge about and be aware of. And to feel comfortable kind of having these kind of difficult conversations. So thank you for the opportunity to be here. I just really appreciate it. Before we get started, just a few things. We've recognized that this can be a very difficult topic at times. So if you need to take a break or step out, please do so. We certainly respect the need to kind of give yourself some space and some time for processing some of the information here. There is a national suicide prevention lifeline if anybody ever needs to reach out for some support. If you happen to be a service member or a veteran, you can call that number and press 1, and that will connect you specifically to the Veterans Crisis Line. And if any of the veterans in our area or in the Hampton Roads kind of area calls, they let us know, and we follow up with that veteran within 24 business hours. But that's true for across the nation. So if any veteran calls the Veterans Crisis Line or a service member, they will let the local VA know with the person's consent, and then that VA can reach out to that person. So please use that as a resource for yourself and for anybody else who may need it. So the objectives for today, we hope that by participating in this training that you will have a general understanding of the scope of suicide within the United States, know how to start a conversation about lethal means safety, and have a general understanding of options for ensuring safe storage of lethal means. In the context of suicide prevention, safe storage of lethal means is any action that builds in time and space between a suicidal impulse and the ability to harm oneself. Effective lethal means safety education and counseling is collaborative and veteran-centered. It respects the important role that guns and medications may play in a veteran's life. That conversation is consistent with their values and priorities. We don't talk about restriction. We don't talk about firearm restriction or medication restriction, but we want to just kind of focus on ways to keep the veteran and their loved ones safe. So the terminology is important, and the way you talk about keeping others safe is important to choose your words kind of wisely and carefully. When somebody is in a suicidal crisis, that crisis typically does not last a long time. Most last minutes to hours. 47% said of veterans surveyed said that it took less than an hour between their decision to attempt suicide and their actual attempt. 24% said it took less than 5 minutes for them to act. About 90% of people who survived a suicide attempt do not go on to die by suicide. So reducing access to lethal suicide methods is one of the few population level interventions that's been shown to decrease suicide rates. Building in time and space between the impulse to act and the means to harm oneself saves lives, because while some of those crises last a long time, again, you can see by this slide that really that crisis is very, very short-lived. So if we can kind of intervene in that short minutes to hours period, then the odds of an adverse outcome are reduced considerably. So if we can collaborate with the veteran ahead of time to help them survive a suicidal crisis, then we have likely prevented their suicide for the rest of their lives, because again, about 90% of people who survive a suicide attempt do not go on to die by suicide. So this is a really powerful slide, I think, and it just kind of emphasizes again the critical time period that we have for intervening during a crisis. You know, I know that in the midst of a crisis situation, minutes can feel like hours, hours can feel like days. But the reality is those crises usually are short-lived. And so this just kind of underscores the importance of reducing access to means for those who are at elevated risk for suicide until the risk period passes. Access to lethal means increases suicide risk for everyone living in the home. The acute phase of a suicidal crisis is often brief. So building in time and space, even like 30 to 60 minutes between impulse to act and the means to harm oneself, saves lives. We know that people rarely substitute one means for another. So it's important to restrict whichever means they have in mind to use. And I use the word restrict there, but I want to kind of backpedal a little bit. Let's talk about reducing access, safe storage. Also means matter. So how a person attempts suicide impacts how fatal the injury will be. About 90% of firearm-related suicide attempts are fatal, as compared to approximately 5% of suicide attempts combined by all other mechanisms. So 90% of firearm-related suicide attempts are fatal, as compared to approximately 5% of suicide attempts by all other mechanisms combined. So this is why we talk about lethal means, safety, and storage. So a suicidal crisis can escalate quickly. This doesn't mean that it occurs out of the blue. However, a person may go rapidly from feeling distressed to having suicidal thoughts to ultimately making an attempt. The impulse to end one's life and the readiness to actually go through with an attempt are usually short-lived and not a chronic state. The crisis usually fades, but it may flare up from time to time. A suicidal crisis is hard to predict, triggered not only by mental health or substance use issues, but often by stress and external events, such as an arrest, an argument, or a relationship breakup, or a pandemic. This is the world that we're living in now. Since a suicidal crisis is often difficult to predict and can escalate rapidly, reducing access to lethal means, such as a firearm, before a suicidal crisis occurs can help save someone's life. So we're going to talk a little bit about just the rates and methods from, this is from the 2019 National Veterans Suicide Prevention Annual Report. And what that study tells us is that the rate of suicide is 2.2 times higher among female veterans compared with non-veteran adult women. The rate of suicide is 1.3 times higher among male veterans compared with non-veteran adult men. Male veterans age 18 to 34 have the highest rate of suicide, and male veterans age 55 and older experience the highest count of suicide. 69% of all veteran suicide deaths resulted from a firearm injury. So there's that firearm injury information again. There are many factors that contribute to suicide rates, such as access to lethal means. And those factors may vary across states, leading to differences in suicide rates nationally. The VA respects the important role firearms play in many veterans' lives. VA is dedicated to educating veterans and their families about the safe storage of firearms in a way that is consistent with each veteran's values and priorities. Secure storage can put time and space between an individual and a firearm during the acute phase of a suicidal crisis. It is a myth that if somebody really wants to die by suicide, there is nothing that can be done. The reality is, again, that the acute risk for suicide is often brief or time limited. When a lethal mean is unavailable at the moment of intended action, an attempt may be thwarted until the potentially brief period of high risk passes. Veterans, of course, naturally by default have a high degree of familiarity with firearms and are more likely than members of the US general population to have access to firearms. Half of veterans own at least one firearm. 1/3 of those veterans store a firearm loaded and unlocked. Many case-controlled and cross-sectional studies have found that firearm access is an independent risk factor for suicide. Access to firearms, independent of underlying rates of suicidal behavior or mental health diagnosis, largely determines variations in suicide mortality. So even just the access to the firearms. And this is a graph that kind of is a great visual for what I had talked about a few moments ago. That with a firearm injury, 85 to 90% of those are fatal, compared to 5% of all other methods combined. And I came across a quote that says, owning a firearm is both a right and a responsibility. So what does it mean to operationalize lethal means safety? How do we do that? Lethal means safety counseling is a patient-centered rather than one-size-fits-all intervention. Effective lethal means safety counseling involves careful consideration of language and approach. Whenever possible, it is an ongoing conversation that includes a veteran's loved ones. Factors that may affect your approach include your relationship with the veteran, your knowledge about their access to firearms or lethal medications, their reasons for firearm ownership or the necessity of their medications, your knowledge of and comfort with firearms or other means, the urgency of the situation, and the veteran's willingness to consider changes. These are just a few of the things. I mean, there may be other things that kind of come up in your conversation or in that dialogue, but these are some things to kind of have on the forefront of your mind and kind of process before you start to have that conversation. So how do you start the conversation? You can ask things like, how do you currently store your firearms or your medications? What concerns do you have about storing them safely? Who could hold the key to your gun lock or set the combination to your gun safe just for a while until this rough part is over? This does not have to be a forever commitment. And that's something I really emphasize with my veterans in my role as suicide prevention coordinator is, look, this doesn't have to be a lifetime commitment of never having access to your firearms, but in this moment right now, while you're in crisis, can we talk about ways to secure that so that you're safe and that everybody else in the household is safe as well? You can ask things like, how will we know when it's time to take extra steps or to do something differently? And ask them, you know, really open-ended question. Can you think of anything else you could do to increase your safety during this tough time? So you tell me, you know, I have some ideas, but what do you think? Where are you at with this? And hopefully, you know, that starts a dialogue, it starts a back and forth conversation. We're not using terms like restriction or removal. We use things like motivational interviewing to encourage the veterans' investment in safe storage of the lethal means. So how to respond. So if somebody says, if I get rid of my guns, I will just use another method to kill myself. So research suggests that people rarely substitute their method. It's not impossible, not to say that it's never happened, but it's a rare occurrence if it does. And even if they use a different method, as we saw on the slide before, almost every other method is less lethal and offers more time for rescue or for the person to change their mind. If the response you get is, I need my guns for self-defense, you know, we have a study from the National Crime and Victimization Survey. People reported that they defended themselves with a firearm in less than 1% of crimes. What are the risks versus benefits of having an unsafely stored firearm? Harming yourself, someone else, the children in the home, versus the likelihood of defending yourself. Are there other ways you could defend yourself? Would you consider getting, you know, a home security system, a big dog? You know, have those conversations and really work with them to kind of meet them where they're at and understand the reasoning, the rationale behind their current use of storing, you know, lethal means. Messaging matters. Our choices of words matter. So lots of veterans have guns at home. You can say like what some veterans in your situation have done is store their guns away from their home until they're feeling better, or lock them up and ask someone they trust to hold on to the keys. If you have guns at home, I'm just wondering if you've thought about a strategy like that. If temporarily storing them somewhere else is not an option, perhaps we can discuss some alternative ways to keep you safe until you're feeling better. Also, studies have shown that having a firearm in the home raises the risk of a firearm-related injury or death for everyone in the home, not just the veteran. And for some folks, that can kind of be a turning point for them. Recognizing that this is a risk for everybody. It's a risk for their children, for their spouse. And so we just really want to acknowledge why they own a firearm or why they have these medications, and validate their kind of their reasoning and their emotions related to that, but emphasizing safety and autonomous choice. And as a side note, but I think just important to note, is that it's essential for healthcare providers to document their discussions about lethal means safety and counseling. So you want to make sure that you're putting in your documentation that we talked about their firearms, we talked about safe storage. The VA has free gun locks for any veteran who wants one. Just have to ask. We'd be happy to send them out. We talked about storing medications too, and we'll talk about medications in a moment. So really important as providers to also document your own conversations with those things. So reducing risk, tools and resources. So one of the big tools that we use within the VA is the suicide prevention safety plans. And one of the pieces of that safety plan is making the environment safe. So how can I make my environment safe? And there will be things like temporarily removing the firearm from the home, gun locks that we have for free. Trigger locks, we don't have those. The ones that the VA has go through the chamber, but it has a key and they can give the key to somebody. Also, gun safes are an option. Medication take-back events. There was a big take-back event in October that we worked with the police department with. But you can go to the DEA.gov website and look for locations where you can safely dispose of medications at like pharmacies and things like that. Medication removal boxes, medication mailback envelopes. The VA has those as well for veterans. If they are unable to get to any of the safe disposal locations, the VA has a blue MedSafe box in the pharmacy. But with the pandemic and people not necessarily going into the VA, the hospital can also, the pharmacy can also mail out envelopes where the veteran just puts their medication in the envelope and mails it off and it gets destroyed safely. There are also things like blister packs for medications, lock boxes for medications, and naloxone kits. So temporary offsite storage options include with family members, friends, police departments, depending on your location and your police department, gun shops, shooting clubs, pawn shops. In some states, veterans may need to undergo a background check before reclaiming their firearms. Safe storage options in the home, preferably while giving a key or safe combination to somebody else, a loved one. Include things like cable locks, like we have at the VA, trigger locks, lockbox, a life jacket, a gun safe or cabinet, and really just storing the ammunition separately from guns can reduce suicide risk. So if you have somebody who absolutely does not want to secure their firearm in a way that we've talked about, then okay, let's at least talk about putting the ammunition, in the attic, and you can keep the firearm near you, and at least just separating, because again, we want to create that space and that time for reducing access to the means in that moment. You can ask a friend or a relative, as long as they aren't prohibited from possessing a firearm. You could store these things in a storage facility. The ammunition usually must be stored separately. So, have a conversation with the storage facility owners about that. But some police departments will temporarily store at no charge, And then the pawn shops, you can pawn the gun for a very small loan amount. It's a reliable storage option, and the interest fees are about 15 to 20% monthly. Other things like gun stores or gun clubs, some may offer free, inexpensive storage options for people that they know. So we have options. There are things out there, there are resources out there that you can use. And these are just some visuals about what these look like. So the cable lock is what we have at the VA. They are affordable, they are accessible, they are a theft deterrent. Just requires a little key, and ideally the person would be willing to give that key to somebody else to hold on to for a while. So that's a conversation that we could maybe have with them. You could certainly look at a gun case, and as we kind of go through these options, they become a little bit more expensive as you go. So just depending on their situation, a lockbox, an electronic lockbox, and then a full-size and biometric gun safes. So they have the ones where you can use your thumbprint to open it. So there are options out there. When considering temporary gun storage with friends or relatives, under this federal law, a person should not ask someone to store their firearm if that person is prohibited from possessing a firearm. This includes individuals who have been convicted of a felony or a domestic violence misdemeanor, have a domestic violence restraining order against them, have been hospitalized involuntarily, or determined to be mentally incompetent, or using controlled substances illegally. So some things to think about. This is not just kind of give it to the guy next door. You want to make sure you know who's taking possession of that firearm, because you don't want to make your own situation worse than it already is. Similar to domestic violence restraining orders, these laws typically enable family members and police to petition a court to issue an emergency order to remove a person's gun if the person is at clear risk of harming themselves or others and will not voluntarily give their guns for safekeeping. So this is the extreme risk protection laws. So to learn more about these laws and whether your state has one, please note the website above at the Giffords Law Center. In the state of Virginia, only law enforcement or state officials can petition for an ERPO. So depending on where you're at, you can look at the Giffords Law Center website and find information that is relevant to your location. So we've talked a lot about firearms, but it's not only firearms that we need to talk about. So medications. So about 98% of overdose attempts are not fatal. In 2016, 10% of male veteran and 32% of female veteran suicides were due to intentional poisoning. Most attention right now, and appropriately so, is on opiate medications, both prescribed and unprescribed, and particularly for patients receiving both opiates and benzodiazepines. And I'm not a physician, but my understanding is that it's the suppression of the respiratory system. So they stop breathing. If you take those together, the risk for stopping breathing is elevated considerably. Other medications that we see implicated in suicide attempts are acetaminophen or Tylenol, antipsychotics, antidepressants, and anti-seizure medications. Having a family member or friend administer medication in the correct dosage is a great way to kind of reduce risk, especially during those elevated periods of crisis and suicidal ideations, or if there's recent suicidal behavior. Portioning out pills for a few days and locking the rest away, or giving them to a trusted family member or a friend, someone that you know is not going to misuse them or abuse them in any way. You can also ask a doctor or the pharmacist to limit the number of refills or the quantity of pills prescribed. You can dispose of unused medications at a pharmacy or using safe home disposal kits like we talked about a moment ago. Again, the VA pharmacy can mail out medication disposal envelopes, and they just put the medication in the envelope and mail it out, and it's prepaid. So they don't have to do anything beyond that. Or looking at the DEA.gov website. And then also having conversations about opioid safety, naloxone distribution, which is targeted for those prescribed opioid medications and for illicit opioid or heroin use. So safety planning, again, this is something that we use regularly at the VA, and it's kind of a living document. It's a note. I tell my veterans it's a note in their chart, but it's also something that I print out and mail to them. And the idea is that when you're in a suicidal crisis, it can be tough to kind of think clearly about who are my support system individuals, how do I cope on my own? And so this is a hard document, something that you can pull out and reference without thinking too much about it. So the first part of a safety plan is just recognizing your warning signs. How will I know that I'm in crisis and that I need to use my safety plan? Thoughts, things like I'm worthless or I don't matter. Feeling really sad or hopeless. Behaviors, I start to isolate more, or symptoms, I'm sleeping too much. Step 2 is internal coping strategies. So things that you can do on your own that don't require anybody else's help or support or input. These are typically things such as, reading a book, taking a nice long bath, going for a walk, things that don't require anybody else to kind of be there for you, that you can kind of hopefully use on your own. 3 is people in social settings that provide distraction. This has been a bit of a challenge since COVID started. We've had to be pretty creative about how we're involving other people in social settings due to COVID. But we can talk about things that kind of make you feel better, like going to the beach or going for a walk, just to be around other people, not necessarily close to them, but just in the presence of other people. The 4th part of this is people who I can ask for help if distraction alone doesn't fully work. So when I need to talk about how I'm feeling, these are the people that I can call. They're supportive, they care about me, they want to help guide me through that crisis. Step 5 is the professionals or agencies that you can contact during a crisis. So that is your therapist, your suicide prevention coordinator, your primary care doctor, certainly the Veterans Crisis Line, or even local urgent care services. So these are the folks that you can call when you need professional intervention. And then making the environment safe, right? We've talked a lot about that. Safely storing firearms with gun safes and locks and things like that. Medications, again, limiting the number of refills or the number of pills received in one prescription, or having a family member help set up a medication box so that you don't have, a full 30-day supply of that medication, you have 7 days. Household toxins and sharp or other dangerous objects, again, talking to somebody about maybe holding on to those things for a little while, or maybe putting them in a safe storage location. Every situation is different, and the conversations are unique to that person in that situation, but sometimes we have to be creative, and that's okay. So My 3 is an app that you can use that it has a safety plan option. So everybody's always looking at their phones anyway these days, right? So instead of holding a piece of paper like the one that we were just talking about with the safety plan, My 3 is a way to put that into your phone. So it doesn't have to necessarily be an obvious thing that you're doing. I believe you can send this safety plan to other people digitally as well, to let them know that they're included in the safety plan, and this is kind of what I need to do if I'm in crisis. So project childsafe.org talks about owning firearms, respecting it, and securing it. The VA has released the Safe Firearms Storage Toolkit, which was developed in partnership with the American Foundation for Suicide Prevention and the National Shooting Sports Foundation, which is the trade association for the firearms industry. The toolkit guides communities through the process of building coalitions to raise awareness about safe storage and its connection to suicide prevention. And I think that this is important to talk about because, even firearm dealers and, the people who enjoy kind of shooting clubs and hunting organizations, everybody should be having a conversation about safe storage of firearms. It is not intended to restrict anyone's access to these things. It's intended to respect the fact that these can be lethal. Everyone has a role to play in promoting lethal means safety. Healthcare and social service providers are in a unique position to educate veterans at risk, as well as their loved ones, about the importance of safe storage of lethal means. For non-VA providers, additional information and training can be found in the Suicide Prevention Resource Center's Counseling on Access to Lethal Means, and that is the sprc.org website there. Their safety planning, Lock and Talk Virginia is a campaign that works with shooting clubs, hunting organizations, and others to help promote firearm safety. So everybody needs to kind of have these conversations on an ongoing basis. So this is from the sprc.org website, Counseling on Access to Lethal Means, or CALM course. It is intended to improve your knowledge and skills in suicide prevention. They're self-paced online courses. They're free of charge and open to anyone. I believe you have to register to take them, but it's a great resource for, again, kind of learning the language, being comfortable with the conversation. The SAVE training is, excuse me, is a training that we provide within the VA system. We provide it to new employees, but we also are reaching out into the community because suicide prevention is a public health issue. And we know that not all veterans are receiving VA care. In fact, a significant portion of them are not. So we want to try to reach them in the communities where they are. So we are providing SAVE training to faith-based organizations, education institutes, first responders, you name it. We are ready and willing and able to provide the SAVE training to anybody who's willing to receive it. But you can also go to the psycharmorinstitute.org website and watch a 25-minute video, which kind of covers the same ground. SAVE stands for recognizing the signs of suicidal thinking, being comfortable asking the most important question of all, which is, are you thinking about killing yourself? And it's important to ask that question in a way that is direct, straightforward, with no room for misunderstanding. Sometimes people will say, well, are you thinking about hurting yourself? To be honest, that leaves a lot of room for misunderstanding. Hurting yourself can mean a lot of different things to a lot of different people. And we want to make sure that we have a very clear understanding of if they say yes, what that means. So instead of kind of beating around the bush, let's just ask the question. Are you thinking about killing yourself? And that's a yes or no question. V stands for validating the veteran's experience. So recognizing that they're having a conversation with you, that they are in emotional pain, and not making sure that we're not judging them, making sure that we are kind of meeting them where they are instead of being dismissive of their emotions or their pain. And then encourage or expedite getting help is the E in SAVE. So let them know that help is available. We have resources, but we want to expedite getting help. And how quickly that happens depends on the acuity of the situation that you're in. If you think about suicidal thoughts kind of being on a spectrum, if they are at a point where they, kind of want to go to sleep but not wake up, but don't really have a plan or intent to harm themselves, that's a very different process than somebody who says, I plan to overdose when I get home today at 5 o'clock. I have the medication in my cabinet. I'm ready to do it. The response to those two situations, they're both going to get help, but one of them is going to be more acute than the other. So if you have a moment or 25 minutes, it might be worthwhile to take the psycharmorinstitute.org video, just kind of take that in and kind of understand the process. But also, if anybody is needing that training in their communities, please let us know. So this is the Veterans Crisis and Military Crisis Line. I cannot say enough good things about these folks. They work 24/7, 365. They provide incredible support and resources to our veterans and our military service members. Also, third-party callers will call on behalf of those folks. So again, if for Hampton, if somebody in the Hampton Roads area calls, we will follow up within 24 business hours. But that's true nationally. So if it's somebody in Oregon and they call the Veterans or Military Crisis Line, as long as that caller agrees to it, the VCL will send a referral to the VA in that area in Oregon, and those folks will follow up with them too to make sure that they're linked with services and they have what they need. So this is a timeline from 2007 to 2018. In that time, and obviously it's much more since then, but in that time, the VCL responded to 4.4 million calls. They had more than 511,000 chats, 150,000 texts, and more than 761,000 referrals to this local suicide prevention coordinator. And then more than 138,000 dispatches of emergency services. Those numbers have likely gone up dramatically, particularly in the past 9 months or so. We're seeing a lot of calls through the VCL. So the hashtag Be There initiative is something that you can kind of look up, explore on the internet. It was an initiative to kind of encourage the friends and family members of veterans to just be there. You don't have to be a subject matter expert to help somebody through a crisis. It can feel like that sometimes. The reality is that just kind of being there for them, validating their experience, listening more than you talk, encouraging them to get help, that can be enough to save a life. You don't have to be a therapist or a psychiatrist. You have to be there and support them in that moment. So this is a great program that I've used myself a few times within my work as a suicide prevention coordinator. So it's a suicide risk management consultation program for anybody who's serving veterans. You can email them any questions about, excuse me, about risk stratification, assessments, lethal means safety counseling, how to engage veterans who are at high risk, how to document those really tricky situations where it's just sticky and hard to really document in a way that feels clinically appropriate and accurate. These folks can provide amazing resources for you, but they can also provide support after a suicide loss. And their hashtag Never Worry Alone, I think, is kind of sums it up. They're a great resource. MakeTheConnection.net is an online resource featuring hundreds of veterans telling their stories about overcoming mental health challenges. That can be a great resource for veterans who are a little bit on the fence about really engaging in mental health care. It can help to hear that other people have been through similar situations. No two situations are the same, but if they've been through something that is similar, then that can kind of help normalize the process a little bit. So this is a great resource as well.
My name is Ryan,
and Coaching into Care is a resource for the family members and friends of the veteran. So if they are looking to help their veteran and encourage them to engage in care, this is actually something that's specifically for those folks. And by default, it's for the veteran, but it's specifically targeted towards family members and loved ones of that veteran. So these are all of the suicide prevention coordinators by region. Myself, Megan Flaherty, and then Shakonda Griffin is the other suicide prevention coordinator that we have. That's our phone numbers and our email addresses there. But I also listed the SPCs for Martinsburg, Mountain Home, Richmond, Salem, and the DC VA Medical Center. You can also look on the Veterans Crisis Line website. They have lists of who the suicide prevention coordinators are. Just a side note too, the VCL, if you were to call the crisis line or want to get in touch with the Veterans Crisis Line, they're available by phone, but as the other slide mentioned, they're also available by text. You can go to the website and just chat with them in a chat box. So there's a couple of options for reaching out to those folks as well. But the Veterans Crisis Line website has this information on it as well. So this is my team. We are a small but mighty team. So myself and Shakonda Griffin, Kevin, Trakisha, and Jenny are our case managers. Dr. Farrow is our psychologist. And then Derek Cately is our suicide prevention MSA. He's our support staff. Mr. Cately has the materials if you're interested in receiving gun locks or cards, wallet cards with crisis line information on them, keychains and magnets and all kinds of good stuff. So if anybody needs that kind of information, please don't hesitate to reach out to really any of us, but Mr. Cately has it in his office. But we'd be happy to put you in touch with him if you needed to. So this is a dedication that came from the Office of Mental Health Suicide Prevention's National Strategy for Preventing Veteran Suicide. And I like to read it because I think this line of work can be very difficult. I think the subject matter can be very difficult, but this inspires hope to me. It says, to veterans who have lost their lives by suicide, to veterans who have thoughts of suicide, to veterans who have made an attempt on their lives, to those caring for a veteran, to those left behind after a death by suicide, to veterans in recovery, and to all those who work tirelessly to prevent veteran suicide and suicide attempts in our nation. We believe that we can and we will make a difference. And so finally, I just want to say thank you. I want to say thank you for listening today. Thank you for being a part of this amazing presentation and the event itself. The keynote speaker was just really powerful, very humbling. Thank you to our active duty military, the veterans, those of you who are supporting them every day. We are forever indebted to you for your service to our nation. And, thank you for trying to make the world a better place. We appreciate you. If anybody needs any information or resources from me, I'm happy to provide it. Megan.flaherty@va.gov is my email, or you can reach out to the folks coordinating this big event and we can kind of get in touch that way. So thank you so much.